What I'm about to tell you might genuinely shake you. The pills sitting in your medicine cabinet right now, the ones you swallow every single morning without a second thought, could be quietly raising your risk of a stroke or heart attack. And here's what nobody tells you. Millions of people over 60 are taking these exact medications, completely unaware that they may be doing far more harm than good. I know that sounds frightening, but stay with me, because this is one of those conversations that could genuinely save your life, or the life of someone you love deeply. By the end of this video, you'll know exactly which 5 common pills carry the biggest hidden heart risks after 60, why your aging body reacts to them differently than it did at 30, and the simple alternatives that protect your heart instead of attacking it. But first, you need to understand something most doctors will never sit down and explain to you. My name is Dr. Waterley. I'm a senior health specialist with 13 years of clinical experience working directly with patients over the age of 60. In those 13 years, I've watched the same heartbreaking pattern repeat itself again and again. Good people, taking pills they trust, ending up in emergency rooms with problems those pills caused. Today, I'm not going to give you generic advice. I'm going to tell you exactly what I would tell my own mother if she were sitting across from me right now. Here's the truth nobody talks about. Once you cross the age of 60, your body processes medications in a completely different way than it used to. Your liver, the organ responsible for breaking down drugs, slows down significantly. Your kidneys, which flush those drugs out, lose roughly 30 to 40% of their filtering capacity by the time you reach 70. Your heart muscle becomes more sensitive to even small chemical shifts in your bloodstream. And the lining of your blood vessels, what we call the endothelium, which is simply the inner wall of your arteries, becomes thinner and more reactive. That means a pill that was perfectly safe for you at 35 could be quietly damaging your heart at 65. Most of my patients walk in taking 6, 8, sometimes 12 different pills a day. And when I ask them what each one does, they look at me and say, "Doctor, I don't really know. My other doctor just told me to take them." That right there is the problem. Because polypharmacy, that's the medical term for taking multiple medications at the same time, multiplies your risk with every additional pill. And here's where it gets interesting. 5 of the most common medications people over 60 take every single day have been linked in published studies to a significantly higher risk of heart attack and stroke. Let me walk you through each one. Number 5. The painkiller almost everyone trusts. Let's start with a class of drugs called NSAIDs, non-steroidal anti-inflammatory drugs. You may not recognize that name, but you absolutely recognize the brands. Ibuprofen, naproxen, the little orange and blue pills people swallow for headaches, back pain, sore joints, arthritis flare-ups. Because you can buy them over the counter without a prescription, most people assume they're completely harmless. They think, if it were dangerous, surely they wouldn't sell it next to the chewing gum. That assumption is wrong. Dead wrong. Here's what the research actually shows. A major meta-analysis published in the British Medical Journal found that regular use of these painkillers can raise the risk of a heart attack by anywhere from 20 to 50%. Let that sink in. You take a pill for your aching knee, and you may be raising your chance of a heart attack by up to half. The mechanism is straightforward. These drugs cause your body to retain sodium and water, which pushes your blood pressure up. And the scary part? This increased risk can kick in within just the first few weeks of regular use. You don't have to be on these for years to be in danger. I've personally treated patients whose stubborn high blood pressure refused to come down until we discovered they were taking ibuprofen every single morning. The moment we switched them to a safer alternative, their pressure dropped almost overnight. That's how direct the connection is. Stay with me, because the next one is even more common than this, and the cardiac risk is almost completely unknown to the public. Number 4. The cold and flu pill hiding in plain sight. The next medication is one you reach for the moment you feel a cold coming on. Decongestants. The 2 big names you need to know are pseudoephedrine and phenylephrine, the active ingredients in many of those familiar cold and flu medicines lining the pharmacy shelves. These drugs work by constricting the blood vessels in your nose so you can breathe again. That sounds wonderful. The problem is, They don't just constrict the blood vessels in your nose, they constrict every blood vessel in your body. And when your blood vessels narrow, your blood pressure rises, sometimes dramatically. For a healthy 30-year-old, that spike isn't a big deal. For someone over 60, someone who may already have high blood pressure, narrowed arteries, or a history of cardiovascular issues, that same spike can be the trigger that pushes you over the edge into a heart attack or stroke. I've personally seen patients land in the emergency room with what we call a hypertensive crisis. That simply means blood pressure spiking to dangerous levels, and when we traced it back, the culprit was an innocent looking over the counter cold pill they'd been taking for a week. Most people never make the connection. They think cold medicine is harmless. It isn't, not for your heart, not after 60. And here's where it gets even more interesting. The third pill on this list is one tens of millions of seniors are still taking right now. Number 3. The heartburn pill that quietly drains your heart. The third medication is one that affects tens of millions of people worldwide. These are called proton pump inhibitors, or PPIs for short. They're the pills people take for acid reflux, heartburn, and stomach ulcers. Like the painkillers we discussed, many of these are available right off the shelf, which gives people the false impression they're completely safe. Now, I want to be fair, PPIs are remarkable medications when used the right way for the right amount of time. They were designed for short-term use, typically 4 to 8 weeks. But the reality, millions of seniors take them for months, years, sometimes decades. And that's where the danger lives. Research published in the journal Circulation and a major Stanford University study found that long-term PPI users had a 20 to 30% higher risk of a cardiovascular event compared to people not taking these drugs. The mechanism behind this is fascinating and frightening at the same time. PPIs appear to interfere with your body's production of nitric oxide. Nitric oxide is critical. It's the chemical that keeps your blood vessels relaxed, open, and flexible. When that production drops, your blood vessels start to tighten, blood flow gets restricted, and heart attack risk climbs. But here's the part nobody talks about. Long-term PPI use also depletes your magnesium levels. Magnesium is one of the single most important minerals for your heart. It regulates your heartbeat, supports healthy blood pressure, and helps prevent dangerous blood clots. When your magnesium quietly drops over months and years of PPI use, you become vulnerable to arrhythmias. That simply means an irregular heartbeat, and some of those rhythms can be life-threatening. The frustrating part is, low magnesium often doesn't announce itself. You might feel a little more tired, a muscle cramp here and there, a subtle flutter in your chest. And you'd never in a million years connect those symptoms to the little pill you take every morning for heartburn. If you've been on a PI for more than a couple of months, please have that conversation with your doctor. Ask for a magnesium blood test. It's simple, it's cheap, and it could save your life. Number 2. The antibiotic doctors hand out like candy. The fourth pill on this list is one that gets prescribed more freely than almost any other drug, especially to seniors. I'm talking about a class of antibiotics called macrolides, and the most famous one is azithromycin, what most patients know as the Z-Pack. Got a sinus infection? Here's a Z-Pack. Bronchitis? Z-Pack. A cough that might be viral and wouldn't even respond to antibiotics? Still a Z-Pack. Doctors hand these out by the millions because they're convenient. Only 5 days of pills and patients love them. But here's what your prescription label will never tell you. A landmark study published in the New England Journal of Medicine found that patients taking azithromycin had a significantly higher risk of cardiovascular death compared to patients taking other antibiotics, or no antibiotics at all. And that risk was especially elevated in people who already had existing heart conditions, which describes a huge percentage of people over 60. The way it works is this. Macrolide antibiotics can disturb the electrical wiring of your heart. They lengthen something called the QT interval. That simply means the amount of time your heart takes to recharge between beats. When that interval gets too long, it can trigger a dangerous arrhythmia called torsades de pointes, which can lead to sudden cardiac arrest. And when you combine this antibiotic with other medications that also affect your heart rhythm, which many seniors are already taking, the risk multiplies. I'm not saying never take it. I'm saying never take it without telling your doctor every other pill you're on. And honestly, most of the time when seniors get prescribed a Z-Pak for a cold or mild respiratory bug, they didn't even need an antibiotic in the first place, because those infections are usually viral. Be your own advocate. Ask questions. Quick favor, if this is opening your eyes, drop a comment below telling me which of these pills you or a loved one have been taking. Which one surprised you the most so far? I read every comment. And tell me, how old are you? Because the next one I'm about to reveal is the most overlooked of all, and it's in millions of medicine cabinets right now. Number 1. The mood pill almost nobody connects to the heart, and now we arrive at the first pill on this list, and I saved this one for last because it's prescribed more than almost any other class of drug to seniors, and the heart risk gets ignored almost every single time. I'm talking about certain antidepressants, specifically a class called tricyclic antidepressants, which we call TCAs, and certain SSRIs, which stands for selective serotonin reuptake inhibitors. Now, I want to be absolutely clear. Depression and anxiety are serious. They affect millions of older adults, and medication can be genuinely life-changing for those who need it. I am not telling you to stop your antidepressant. What I am telling you is that some of these drugs carry real cardiovascular risks that need to be weighed carefully after 60. Let's start with tricyclics. These are older medications like amitriptyline and nortriptyline. They're prescribed less often today, but they're still used regularly for chronic pain, migraines, and sleep problems in seniors. The trouble with TCAs is that they affect your heart's electrical system. Just like the antibiotics we talked about, TCAs can prolong that QT interval and trigger dangerous rhythms. They can also cause something called orthostatic hypotension, that's a sudden drop in blood pressure when you stand up, which leads to dizziness, falls, fractured hips, and in some cases, reduced blood flow to the brain itself. Studies have linked TCA use in older adults to higher rates of heart attack, stroke, and sudden cardiac death. The SSRIs are a more nuanced picture. Some are gentler on the heart, but one in particular, citalopram, has been flagged by the FDA for what we call dose-dependent QT prolongation, meaning the higher the dose, the greater the risk to your heart rhythm. That's why the FDA actually recommends a lower maximum dose for older adults than for younger people. And here's something that gets missed in routine checkups all the time. SSRIs can interact with other medications seniors commonly take, blood thinners like warfarin, which raises bleeding risk, and other serotonin-affecting drugs, which can trigger a dangerous condition called serotonin syndrome. I see this underestimated in clinical practice constantly. Each pill looks safe on its own. Combined, they can become deadly. That's why having one doctor who sees your complete medication list, not 3 doctors prescribing in isolation, is one of the most important things you can do for yourself after 60. I want to tell you about a patient named Margaret. She was 68, a retired school teacher, sharp as a tack, and one of the kindest women I've ever had walk through my door. Margaret came in complaining of heart palpitations, that fluttering feeling in her chest that wouldn't go away. She also mentioned she'd been feeling more tired than usual, with occasional muscle cramps in her legs at night. Her primary doctor had told her it was probably just anxiety and prescribed her NSAIDs on top of everything else she was already taking. When she sat down across from me, I asked her one simple question. I said, "Margaret, can you bring me every single pill you're currently taking, prescription and over-the-counter, and lay them out on this table next visit?" She came back the following week with a small grocery bag. Inside were 11 different medications. 11. Including a daily ibuprofen for her arthritis, a PPI she'd been on for 9 years for occasional heartburn, a Z-Pak she'd just finished for a cough, and now the new antidepressant. We ran her blood work. Her magnesium was dangerously low. Her QT interval was prolonged. Her blood pressure was climbing despite her medication. The fix wasn't more pills. It was fewer. We carefully, slowly, with her primary doctor's involvement, tapered her off 3 medications, replaced 2 with safer alternatives, and added magnesium. Within 6 weeks, her palpitations stopped. Her energy returned. Her blood pressure dropped to a healthier range. Margaret looked at me with tears in her eyes and said, I feel like myself again for the first time in 5 years. That moment stayed with me, and it's why I'm sitting here making this video for you today. Here's exactly what to do after watching this video. Write down every single pill you take, including over-the-counter ones, vitamins, and supplements, because your doctor cannot protect your heart if they don't see the full list. Take that list to your next doctor's appointment and ask 3 questions. Do I still need each of these? Is any of these affecting my heart? Are any of them interacting with each other in dangerous ways? If you're regularly reaching for painkillers like ibuprofen or naproxen, ask your doctor about safer alternatives, acetaminophen, topical creams, physical therapy, or natural anti-inflammatories like turmeric or omega-3s, because chronic painkiller use silently strains your heart. If you take a heartburn pill daily, ask your doctor whether you still need it and request a magnesium blood test, because long-term use quietly drains a mineral your heart cannot live without. Never accept an antibiotic prescription, especially the Z-Pak, without first telling your doctor every other medication you take, because the wrong combination can disturb your heart's electrical system. If you're on an antidepressant, do not stop it, but do schedule a conversation with your doctor about your heart. Ask whether an EKG should be part of your routine monitoring, and make sure one doctor oversees everything. Begin replacing pills with lifestyle wherever possible. 30 minutes of daily walking, a Mediterranean-style diet, 7 to 8 hours of quality sleep, and stress reduction, because these are scientifically proven to lower blood pressure, reduce inflammation, and protect your heart in ways no pill ever could. I want you to leave this video feeling stronger, not scared. Because the truth is this: knowledge is the most powerful medicine you will ever take. You now understand something the vast majority of people over 60 have absolutely no idea about. You know that the painkiller, the cold pill, the heartburn pill, the antibiotic, and the antidepressant, 5 of the most ordinary, trusted, everyday medications in your home, can all silently strain the most important muscle you have. That puts you ahead of millions of people who are swallowing these pills blindly every single day. After 13 years in clinical practice, I have learned one thing above all else. The patients who live the longest, healthiest, most vibrant lives after 60 are not the ones who take the most pills. They are the ones who ask the most questions. They are the ones who refuse to be passive in their own care. They are the ones who treat their bodies like the precious, irreplaceable gift they truly are. Your age is not a weakness. Your age is wisdom. And your knowledge, what you carry in your mind right now after watching this video, is your power. Use it, share it, live by it. Everything I've shared with you today is general health information based on 13 years of clinical experience and published medical research. Every person's situation is unique, and the medications discussed in this video can be genuinely life-saving when prescribed and monitored correctly. Before making any changes to your medications, please speak with your own doctor. Never stop a prescription on your own. If this video helped you, or helped you see something about a loved one's medicine cabinet you hadn't seen before, please share it. That one share might genuinely save a life. Subscribe to Dr. Waterly for more honest senior health insights every week. Take care of yourselves, stay informed. I'll see you in the next one.